once they're developed, it's not so much the teeth get affected by extreme diets. It would be the gums and the periodontal ligament, the little fibres that hold the teeth in place. And I think the example that we said earlier was sailors when they got scurvy because of the lack of the vitamin C. It wasn't the teeth that were affected. It was the sort of gums and the ligaments holding the teeth in that were affected by the lack of vitamins.
And you're saying as well before, you're saying it's not just gums, but actually your tongue can be quite radically affected. Tell us about that.
Yeah, things like the tongue itself. Certain types, some people are sensitive to spicy foods. Some people could be sensitive to things like tomatoes. And there's a condition called geographic tongue. Where the little bumps on everyone has a kind of you're sticking your tongue out. All the little bumps on your tongue, everyone does it, and all the bumps on your tongue are there for a reason. Some of them produce saliva, some of them are there for taste buds, and certain types of spices, foods, whatever chemicals affect those, and they get damaged, they depapillate, they come off. So the tongue itself becomes smooth in certain areas, and it almost looks like a map. Hence the term geographic tongue. Vitamins, if you are iron deficiency, you can get a kind of a very smooth, shiny tongue. Dryness in the mouth, if you suffer from dry mouth from illness or drugs, that will again affect the mouth. So all those sort of things. There's various, and certain drugs can affect the gums as well as the tongue.
Now I'm going to talk like this.
It's fine. I'll carry on, Beth. So, but with that geographic tongue thing, for instance, you're talking about these little bits of your tongue almost coming off. Will they grow back again?
What you find is the map changes. So as the turnover of the cells in your mouth is very, very high. So, for instance, there's 2 areas in your body that actually regenerate. One is the roof of your mouth, and the other one in small children is your fingertips. So if a small child damages the end of their finger or cuts it off, it will actually grow back. And likewise in the roof of the mouth, the palate, probably because we're eating and we're scratching the roof of our mouths all the time, those cells are racing. So if a dentist or someone cuts the roof of their mouth, that won't scar, or any scar on there will be minimal because it literally regenerates. So on the side of the gums and things, there's a different place. But there's a high turnover, which is why cuts in the mouth and burns in the mouth tend to sort of heal up really quick. And part of that, that's the reason. So you'll find there'll be an area where the tongue's smooth, and then maybe a week later the papillae grow back again. But then there might be another area where they sort of, they disappear from.
So if there are people who want to sort of change their diet or who are taking these drugs that you mentioned that can sometimes have an effect, is there anything that we can do to prevent these things happening?
Right, well, the drug part, if anyone has side effects from a drug that they've been taking, don't just stop. Obviously go speak to the doctor or speak to the dentist and say, what's going on. Diet-wise, I think with anything, any kind of diet that someone's suggesting, look at it. Do things in moderation first. Because everyone immediately jumps on, it's January, let's all start dieting. Are there simple things that in our normal day-to-day life that we can think, right, well, after each meal, I'll have a yogurt or I'll have something sugary. Maybe I'll cut out desserts for a little bit, or I'll cut down on desserts. So just do little steps. But as well, from a dental point of view, with certain conditions in the mouth are actually made worse by the plaque and the bacteria in your mouth. So the cleaner your mouth, and the less inflammation, and the less bugs, and the less soreness, and the less bleeding gums, and the less swelling gums, and the less sore mouth. So all you got to do is brush, floss, water pick, and just try and keep them clean.
Okay, still can't talk properly. Sorry. Jane wants to know, should you brush your tongue?
You can brush your tongue. It wouldn't do any harm. The tongue itself, because again, it's not sort of furry, but because it's rough, you can get sort of bacteria that do sort of grow onto the tongue. So a gentle brush, or you can also find that some toothbrushes actually have almost like a ridged area on the back, so you can kind of scrape the surface of the tongue gently as well.
Because you can actually get specific tongue scrapers, can't you? Well, would they damage the tongue? Because they seem a bit harsher somewhere.
No, again, you're not ripping at the tongue. It's a sort of gentle scraping, as if it's almost like you're just brushing the area, to sort of get things out. You've got your hand in front of your mouth again. And but I mean, people say to me sometimes, I've got really bad breath. And one way of sort of testing whether you have got breath, if you put your finger kind of towards the back of your mouth or the back of your tongue, and touch it, and then put it on the back of your hand and then smell it. If it honks,
That's how
then-
you do it. Because I've always wondered, because you can't sense it when you try and sort of breathe into your
Exactly.
hand.
No, it
That doesn't work, does it?
No.
So that's how you do it. Intriguing as well about brushing. I was told once by a dental nurse that you should really only use a soft toothbrush and brush very gently. Is that true?
No, that's not true.
Oh, I've been doing it wrong all
That's
this time.
not true. There's a study came out that said that soft toothbrushing actually can cause more damage.
Oh no.
Sake.
Okay, so you don't want a hard toothbrush. You don't necessarily want a soft toothbrush. You want a kind of medium toothbrush. The way to think about it, I'll do it quickly with my hands. I'll try and describe it as well. If you imagine that a brush, the bristles, the end of a brush is the bit that does the work. Okay, so these are the pointy bits of your brush that you want to sort of clean around your teeth. So if you've got a medium brush, it's brushing around the tooth. It's not doing any damage, but it should be doing the cleaning. If you had a soft toothbrush, as you tend to push, people push quite hard, you get more of the area of the bristles, the flat parts, are rubbing against the teeth. With toothpaste, which is slightly abrasive, instead of getting a cleaning action like that, you can hear it with my hands. That's, I don't know, I'll hold the microphone. You can't really hear anything there, but if you've got that, you get more of a scrape.
Yeah.
And the soft toothbrush, because the bristles splay out, can then rub against the surface of the tooth and do more damage.
And is that even if you've got sort of sensitive teeth and maybe sort of slightly receding
You
gums?
probably find it's even worse if you've got sensitive teeth.
Oh, I've been told the wrong thing.
Oh.
I still love her though, even though she told me the wrong information.
Well, remember, you've got to sort of brush, don't push. If you push with your toothbrush, that's the wrong thing. You
So
want
it's
to brush
gentle action, but with a
gentle,
firmer bristle,
and it's
a
also
medium
the
bristle.
sort of a medium bristle. Some people find like kids don't need a hard or a medium toothbrush. They can use a soft toothbrush. But you've got to think about the bugs, the plaque on your teeth are quite soft anyway. So you can get that off just with a nice soft brush. So you don't need to push hard. But a medium brush gets into all the little nooks and crannies.
Lou, speaking of bad breath, wants to know if there's anything you can do about foods that cause bad breath, like, like eating garlic or something like that. Coffee, yeah.
As in, not eat them.
There's some great advice for you there.
So, no, I mean, joking aside, I mean, yeah, I'm afraid, if you're going to eat a load of garlic, then there's going to be a certain amount of garlic honk that's going to, I mean, get everyone else with you, get a big bowl of garlic bread and make sure everyone has a bit. Unfortunately, you can, again, the cleaner your mouth, the less stuff is going to stick inside it. But there isn't really a lot you can do with some of the smells. Also, don't forget, it may not be from your mouth. It could be, some people have sinus problems. They can have problems with their tonsils. So all those sort of things, food and bacteria can stick in those areas, and that's going to create a smell that may not be from your teeth in your mouth.
Could that be, if you do sort of notice quite bad halitosis or whatever you call it, could that be an indication of you actually having a problem with your teeth if there's something maybe sort of stuck there?
It could be a problem with things being stuck in between your teeth or around your teeth. But it could also be a problem, like I said elsewhere, people have things called tonsillitis, and they can have fissures in the tonsils. And so obviously food, instead of being swallowed, fissures.
Oh, fissures.
Not fish airs. Not fish airs. He'll be blowing his horn again in a minute. But no, not fish airs. Fissures in the tonsils, and food can stick in there, and that can then stagnate. And
Pam wants to know what you think about electric toothbrushes.
Great, brilliant. I love the sort of rotary ones are the ones that have been shown in all the studies to work better than the sonic ones.
Damn, got that wrong as well.
Oh, sorry. And they're also a lot cheaper. I mean, a sonic toothbrush is a ridiculous price.
Yeah.
The heads on sonic toothbrushes are quite expensive, whereas a rotary brush, sort of £3-4 for a rotary brush. The other nice thing about a rotary brush, and any toothbrush really, make sure you take the head off, pop it in the dishwasher. Because, you put it in the dishwasher, you turn the dishwasher on, and it's nice and clean. If you go home and have a look at your toothbrush, if it's been sitting in the bathroom cabinet, and if it's been worse, if it's been out of the bathroom cabinet, and if you've got your toilet in, when you flush the loo, if you don't put the lid down, just think what's growing on that toothbrush.
Should you put your ordinary toothbrush in the dishwasher?
Like a manual one. Yeah, that would go in the dishwasher as well.
Brilliant.
That's crackers.